This is a busy, thriving emergency department in San Francisco.
Attention ED staff, rounds will be in suture number 5.
Nowadays, it is becoming the exception and not the norm.
This is one of the first studies that actually shows across the United States that market factors do have a role in the provision of emergency services for people.
Dr. Renee Shaw from San Francisco General Hospital and co-authors tracked all urban hospitals from 1990 through 2007, looking at which ones kept or closed their emergency departments and studied risk factors related to those closures.
If you are in an area where you have high competition, where you have low profit margin, and if your emergency department is in a hospital that's a for-profit hospital, you may be at higher risk of losing your emergency department.
The study appears in this week's JAMA, Journal of the American Medical Association.
Emergency departments close disproportionately in certain areas where hospitals treat a high proportion of patients in poverty, where we have safety net hospitals. Those are hospitals that treat patients who are on Medicaid.
While the law requires hospitals to provide emergency care regardless of a patient's ability to pay, there is no law that says hospitals must operate an emergency department.
If we leave it up to the market, we will have market forces creating financial pressures to result in the fact that you may lose your emergency department if it's not financially profitable.
Just to let you know, because he is somewhat critical.
Okay.
Researchers say local residents who lose their emergency services will seek out other hospitals, and that may create spillover effects.
People will be coming to your emergency department, and there will be more crowding, and that affects you in a very real way. Your outcomes are worse, your waiting is worse, but your mortality is higher, and we have good data to show this.
Catherine Dolf, the JAMA Report.